Throughout the coronavirus outbreak, we've been touching base with health professionals out in the field to check in and see how things are going. And our friend, Dr. Rob Danoff, is running a testing site for Jefferson up in Bucks County. Good morning, Dr. Rob.
Morning, Jim. How you doing?
I'm doing very well. So let's go right into some of these questions. We've been hearing a lot of people have gone in for tests. They have all the symptoms for COVID-19, but then the test pops up as negative. Are there a lot of false negatives out there?
Yeah, so that is, of course, a concern. The tests are supposed to be 95% accurate. Now, of course, that varies. And it also depends, are we using a major lab company that we know is reliable or some other labs? So it's always important to try to find out how accurate is this count. I will tell you this, we have seen some people with negative results that we just felt have it. So if it's negative and they have symptoms, we treat it as if they have this and we'll retest.
A lot of places in our area are still complaining about shortages of supplies and long turnaround periods. What's going on at your location?
Thankfully, the turnaround periods have gotten better by the major labs. Before it was 5 to 7 days. Now we're getting it back in 2 to 3 days, maybe 4. So it's a lot better because they've increased their ability to process these tests. As far as supplies, we're getting better supplies at this point, the swabs and the reagents that are needed for this, but it's really location specific, and we're sharing with different locations.
Speaking of your location, are you seeing the same amount of people that you have in the past, or what are the numbers like?
The numbers are increasing. We're testing more and more people each and every day. Like our site, we're testing consistently now over 100 people a day. And I believe that's going to continue because it's important to know the population, how we're doing. And in order to fight this, we need to identify who's positive, isolate them, so then we decrease the ability of this virus to spread. So we're going to continue testing. It will increase.
So here in Pennsylvania, the governor has said, wear masks if you go out. You've been an advocate of this over the past few weeks. Why so?
So countries that have done this well to fight it, people wear masks besides social distancing. My mask protects you from my germs. Your mask protects me from your germs. So everyone out there, whether it's a mask or some type of cotton device, it's important for us to all do that. That's how we're going to get through this. It's not perfect, but it's a lot better because if we just go out there without the mask, even us by talking and breathing, we can spread this to other people. The mask will help decrease that. So please, everyone, wear some type of cover over your mouth and nose.
So, Dr. Rob, I asked a few folks on Facebook, give me your questions. So here's a few of them. Kathy Jo Gokale said her granddaughter was sick at the end of January, was tested for flu, no strep, but had breathing issues. A lot of people are talking about this, that after the holidays, everyone had these upper respiratory issues. Do you think they may have had COVID-19?
Absolutely. A lot of us think that this started in this area or around there sometime in January. I'll tell you why. A lot of us saw patients with what we thought was the flu, and the flu test kept on coming back negative. So here's the key. There's an antibody test that's coming out. It's out now, but only in little quantities. When we use that widely, it's going to help, such as your viewer, to see if she actually had this before, because we'll be able to see, does she have the antibody to it? So in a few weeks, we're going to test people to see, oh, you probably had this before, and you may be protected. So we're looking into that.
So Virginia Ruber had mentioned that about this test. How long after someone recovers would they actually go for that test?
So once a person gets infected, maybe they have mild symptoms or none, it's going to take about 7 to 11 days to start showing up in the blood if they have had it or been exposed to it. So it's a different type of test. But this is really important because then we'll see what's called the antibody. And then even months later, we'll be able to tell, oh, you know what? You were exposed to this. You probably had it. And you may have a defense against getting it again, or at least decrease the symptoms. And that's really important to know. So this antibody test is going to start to be widely used as soon as it's available and reliable.
So Helen Varicallo had said, if you did have the virus and recovered, when is it safe then for you to be around other people?
So this is something it's really important to talk to your healthcare provider. The CDC says sometimes people as early as 7 days after you started symptoms, you've gotten better. And the last 3 days, you've not had a fever without using any type of medication to decrease the fever. But still, in our area, a lot of people are still waiting about 14 days, even after you've been feeling better. This way it decreases your risk of spreading anything to other people. So this is dependent on you and your healthcare provider working together to see what's best for you and the community.
And our Facebook viewer, Adi Gachet, she has asked if people have existing medical conditions, whether it's thyroid issues or lupus or something, and they're on some sort of maintenance medications, does that help prevent them from getting infected with COVID-19?
That's a really good point. So none of the maintenance medications prevent you from getting COVID-19. But what it does, if we can control your current conditions, diabetes, COPD, we need to control that to make you stronger. Your high blood pressure, we need to control it. Then your body is stronger to fight against this disease. So we have to take care of your medications and your conditions that you have now to maximize your ability to fight off anything else. So it doesn't protect you from it, but it helps make your body stronger.
Well, Dr. Rob, you're always a wealth of information. We appreciate it. Please stay healthy and stay safe, and we'll be checking with you soon.
You too. Be well, Jim, and everybody out there.
Thanks, Dr. Rob.